And we're recording now as well.
Can everyone see the slides? Yep. Okay, perfect. And now just make a start. Okay. Hello, everyone. I'm Abby, and I'm the Deputy Library Services Manager at Birmingham Community Healthcare NHS Foundation Trust. This talk will center around how Smallwood Library collects information for marketing to demonstrate the impact our day-to-day services have. The library has the equivalent of about 3.5 full-time staff serving BCHC colleagues around 300 sites. This makes marketing our services and generating user interest quite a challenge. We cannot overemphasize the importance of selling the library and its services as something invaluable to senior leaders and staff. One example of how we accomplish this is the poster that was submitted for the HLG 75th anniversary competition. It looks at impact in the context of what the services we offer can help accomplish. We collect impact case studies so that stakeholders can see the benefits their colleagues get, and they relate it directly to how the service we provided has been of help. Some of our impact case studies are collected spontaneously, that is, perhaps through a face-to-face encounter with a user, but the majority are gathered through expressions of interests that are identified every quarter. The library conducted a literature search for this case study to find the evidence base to underpin this work, which facilitated outcomes within BCHC and outside BCHC. One outcome is the introduction of a photo app to record pressure ulcers in dark skin tones, as a lot of clinicians undertook their training identifying pressure ulcers in light skin tones. So when presented with a patient who has a dark skin, the care provided seemed to vary from one clinician to another. It also helped save money, as according to NHS Improvement, the NHS spends about 3.8 million on pressure ulcers every day. So early identification reduces that cost. So from a library perspective, what's the service impact? We found that this helped us develop our formal procedure as part of the quality improvement framework, because we're doing this ad hoc to start with, but when the quality improvement framework came up, it gave us the opportunity to develop a formal procedure to meet the outcomes. It also helped us improve the quality of the quarterly reports that we submit for our clinical effectiveness committee. So every quarter, we give information about some of the impact case studies that we have conducted as well. It's a really great source of marketing materials for the service. We get information about how we're doing in the words of our users. We also discovered that our library administrator has quite intriguing creative skills, which I'm sure you agree, because she created that poster. So we've been nurturing that, and she's now our go-to person for all things poster related. So the procedure itself that we run at BCHC has a series of steps that we follow and we've developed. So it's actually something quite formal, and we have it as a guideline within the service. The first thing we do is we send out quarterly impact surveys based on the HEE generic questionnaire. This is sent out by the library assistant. And we found that it's best to send it at a specific time. So it goes out at the end of every quarter. So January to March will go out in April, at the beginning of April, and so on. The next thing we do is we send emails to prospective interviewees along with the consent form. So the impact survey would have asked people if they're interested in being part of an impact case study. And when we retrieve that information, we then send out the email. We always send out the consent form alongside the email. Without the consent form telling us that they approve of what we want to use the information for, we wouldn't go ahead with the interview. The next thing we do is we arrange an interview appointment. It's important to note that all these usually spans quite a long period of time. So from the start to the finish, we might be looking at an average about 6 months. The interview is then conducted via Teams. When this first started, we used to do it face-to-face, but I found that it took quite a lot of time to write up the interviews, and clinicians don't like spending a lot of time outside of their work. So using Teams meant we could actually record the conversation and use Teams to transcribe it at a later date. The questions that we ask are based on the HEE interviewee questions. When you get a copy of these slides, you find that these information is hyperlinked, so you can access those questions if you want to. When we finish transcribing the interview, we then send a copy of the interview form and the case study as we mean to submit it to the interviewee. This does two things. It ensures that what we've captured is what the interviewee expected. And we also find that some people don't really do well in a formal environment. They tend to forget important things because they feel they are under the spotlight. So sometimes when you send them the interview form, they'll remember something else that they hadn't shared in the interview, then you can add it on. We then review the case study for submission eligibility. We don't submit every case study because we found some of them aren't as robust as others. So we determine which one we would submit. And then the next thing we do is we save anything that we're going to use for feedback. We use everything for feedback, but if we're not going to use an interview for a case study, we end up using it for feedback, so no knowledge is wasted. Lessons learned. Timing. Impact requires a time lapse for you to collect it. After a service has been provided, you need to wait a specific, well, at least generally, we always say at least 3 months before you try and identify any impact. The next thing is impact is the gift that just keeps on giving. There's no end. Oftentimes you think you've done the interview, so that's the end of it. No, there's going to still be impact happening, even if you feel you've conducted the interview. So you need to consider whether or not you need to still collect information, even after you've conducted an impact case study. Teamwork, involve all the library team members, because you never know who's going to come across a viable impact case study scenario. So everyone in the team is aware of what it involves and what it will entail, so that if they come across a scenario that's useful for the service, they bring it to my attention. And sourcing. It's important to keep abreast of what's happening, because oftentimes you aren't notified of impact. So you keep an eye out within the trust, on Twitter and other social networks, so that if you see anything you've worked on that has led to something else, then you can contact that user to try and use the opportunity for an impact case study. So on a final note, I find that much like our clinical counterparts, we sometimes use library terminology that come naturally to us, but can confound our users. I know it can be hard because, quite frankly, Open Athens is Open Athens, right? What else are you going to call it? We found that the interviews give us an insight to how users see and describe our services, and this provides us with useful alternatives that can help us bridge the gap between our users and the library. Thank you very much for listening. That's me. Just gonna stop sharing. Over to you, Lindsay.
That's great, Abby. Thank you very much. And I saw a virtual round of applause coming through for you there. So We've got a couple of minutes if anybody has a question. Rachel.
Oh, sorry, I was actually just trying to send a virtual round of applause, but I raised my hand by mistake. Sorry about that.
That's fine. Thank you, Rachel. Sarah, is that a question or a round of applause?
No, it is actually a question. I was just wondering why you settled on 3 months before contacting the users and not a different period.
It's a minimum of 3 months. So what we found is when we send out the impact questionnaires, so if we send out January to March, first week in April. So if it goes out in the first week in April, so someone who perhaps had used the service on March the 31st will be part of that group. So it's not been that long a time. So when they respond, we then contact everyone between April and June in the first week of July. So they get the questionnaire asking them, will they be interested in an impact case study first week in April? If they respond in the affirmative, we're going to wait another 3 months before we then contact them again to say, because the truth is, how do you calculate impact? It's going to take time for it to happen. So it's the easiest way for us to A, make sure that we are contacting everyone, and B, make sure that we're keeping track of who we've contacted, because historically within our service, we do things on a quarterly basis. So it just felt seamless for us. Might not work the same for other people, but it's worked for us. Does that make sense? Does that help? Sorry.
Yeah, that's great. Thank you.
Okay.
Great. Thank you, Sarah, and thank you, Abby. It's 15:15, so we'll move on to our second presentation. But as I say, if anybody does have any more questions for Abby, pop them in the chat and we can hopefully ask her at the end. Shall I hand over to you, Hayley?
Thanks, Lindsay. I'm just going to share my slides, so bear with me for 2 seconds. Hopefully everyone can see my PowerPoint. Perfect. Okay, so I'll start. My name's Hayley Beresford and I'm the clinical librarian at Maidstone and Tunbridge Wells NHS Trust. Unfortunately, my colleague Alison couldn't be with us today, but she sends her apologies. In this session, I'm going to talk to you about mine and Alison's journey setting up a reflective reading club, our initial meeting marking the beginning of our partnership and collaboration together, how we settled on a reflective reading club as a way of addressing research engagement in nurses and allied health professionals, how we captured the impact and where we want to go in the future with our group. So for context, obviously this presentation is based on my poster submission, which was kind of under the theme of partnership and collaboration. Okay, so where did it all start? So back in 2019, I first met Alison when I was new to MTW and setting up the clinical librarian service. And as part of this, I was reaching out to different teams and departments and stakeholders who I would likely be working with in my role and wanting to introduce myself. One of these teams was R&D at Kent and Medway NHS and Social Care Partnership Trust, KMPT. So that's our neighbouring mental health trust that we have a service level agreement with. So I reached out to the head of the service and her team to arrange a meeting so I could showcase what clinical librarians can do, how our teams could work better together in a more integrated fashion, what areas I could potentially support, and if there were any problems that we could solve. We had quite a lengthy discussion, and by the end of this, we were both really keen to capitalise on the natural relationship that exists between our two teams. We're both evidence experts, but in slightly different ways. So as librarians, we're experts in finding, appraising, mobilising information and knowledge, and obviously the research team are experts in designing and delivering evidence. So off the back of that meeting, Alison identified an area that she wanted to work on that she thought I may be able to help with, and that was research engagement. So as a group, nurses and allied health professionals tend to have less engagement with research, and by this we mean engagement as a research consumer, as a research user, and as a creator. And because of this, research becomes unfamiliar, and it can seem intimidating, and this group of staff lack confidence in this area. And because of this, there's this sort of reluctance to proactively seek out research opportunities or get involved with them if and when they do arise. Because of this, ostensibly there looks like there's no demand and there's no sort of awareness or motivation or drive from within the trust to provide these opportunities. So Alison and I thought, well, maybe it's something about the type of opportunities that are available. So as a solution, we envisaged some sort of research interest group or some sort of journal club where like-minded individuals could get together to explore research through literature. And we kind of had a wish list, the things that we wanted, and then we had another list, the things we wanted to avoid. So we wanted a group where we would be focusing on research confidence as an outcome. So more tangible outcomes like research knowledge and skills and usage were secondary. We wanted to create an environment that was informal, friendly and flexible, where attendees could learn from peer-driven content and discussion. What was really important to us was to create an identifiable and distinct partnership, because Alison and I come from different trusts. They're different types of trusts in different teams, and we have different roles. So we wanted our little group to be instantly recognisable, and this is carried through our branding, so our social media posts, our marketing, the slides we use, the certificates our attendees receive, so it's all uniform. What we wanted to avoid or move away from is this idea that journal clubs are just for doctors, and any sort of language or tone that perpetuates this image. We wanted to avoid rigid critical appraisal checklists that are really heavy with stats and methodology. We wanted to minimise or eradicate anxiety around participating, presenting, and any rules or requirements about people's experience, their education, their commitment, or their reason or intention for joining. So this is what we wanted. It was then my job to go away and try and come up with something that met these needs. So I said, Alison, leave it with me. And at that point, as a new librarian, I had to seek assistance elsewhere. So I asked my library team, and I reached out to the wider library community to see if there were any examples or anyone could share any information about similar groups. And luckily, Sue Kerslake, who was library manager at Medway at the time, introduced me to reflective reading clubs. So now I had a name and a model of something that looked much more similar to what Alison and I wanted to achieve, as opposed to traditional journal clubs. Our group eventually ended up being slightly different. So we're not primarily geared towards nurses undergoing sort of revalidation or preceptorship. We are open to nurses and any allied health professional and students. We don't just focus on articles that are about the nursing role, reflective practice or writing. They're more clinical topics that nurses are likely to come across in their practice. So in that sense, they're more similar to journal clubs. So our group is kind of a happy marriage between the two, traditional journal clubs and reflective reading clubs. It's based on the Collins et al. 2015 paper and the Searching, Reviewing, Linking and Action checklist. It's run bi-monthly on Teams. This really works for this particular trust because they're spread across a wide geography. It's co-facilitated by Alison and I, so we have someone from library services, someone from R&D that has a combined expertise across the research cycle, and it's kind of a mix of education and group discussion. So that's what we came up with. I won't go into too much about the process just because of time. But to the evaluation, so we wanted to see after 12 months of doing this whether we was on the right track. Was we achieving what we set out to achieve, which was research confidence? So we put together a mini survey. So this was approved by the KMPT audit team, and it included 5 questions. So we asked recipients, to what extent has the Reflective Reading Club improved your understanding of research terminology, your confidence in reading research, your confidence in discussing it and using it in your practice? And then we had a 5th question, which was a free text response where they could provide any feedback. So of the 35 members in our mailing list it was sent out to, 12 people responded. And between 50 and 80%, as you can see on the screen, indicated that the club had improved their understanding of research terminology, their confidence in reading and discussing research and using it in their practice. At the time, 12 was about the number of people who had actually attended sessions. So our mailing list was comprised of people who had either expressed interest or who had attended. And our average number of attendees is about 6. And these tend to be regular attenders. What I want to draw your attention to is some of the really nice feedback we had. So people talked about it being friendly, interactive, feeling confident, nothing feels too stupid, that it's not too highbrow, it's low key. So these are all positive terms that we were happy to see, because we wanted people to feel confident to approach research, to dip their toe in, and to just get their foot in the door. That's all we was hoping for. So our last slide, I'm just wrapping up. So in terms of the road ahead, we've provided access to a new type of research opportunity. What we want to do going forward is to provide the scaffolding and support that's going to allow attendees to make the most of these sessions. So we plan on introducing some sort of standalone critical appraisal sessions, preparing your manuscript, inviting KMPT nurse authors to talk about their research journey. And this is all about bringing these development and training opportunities into the environment where nurses and allied health professionals feel comfortable with their peers. And eventually we want to see our attendees come back and present their own work and inspire others and sort of spread the message that nurses can be researchers too. So thank you for listening, and that's the end of my talk. Thank you.
That's brilliant, Hayley. Thank you. And again, you're getting another, well, some love and some round of applause in there. So that's great. Thank you.
Thank you.
It sounds really positive, and I'm really impressed at the feedback and the amount of people you're getting coming along. It's great. I think we need to move on to the next presentation. But if people, again, if you've got questions for Hayley, hold on to them, and we'll come back to them at the end. So next up, we've got Barbara and Alison.
Okay, thank you. Alison, do you want me to share, or do you want to share the slides?
No, please you share them. I'm disorganised as always.
Right, I'll share them. I'll introduce myself and then share, and then Alison can introduce herself. So I'm Barbara Moy, and I'm the library manager from Berkshire Healthcare, which is a mental health and community health trust.
And I'm Alison Horner-Larisha. I'm the Library and Knowledge Services Manager at the Royal Berkshire NHS Foundation Trust, which is an acute trust.
Hopefully. See the slides. Has it gone into slideshow?
No. No, it has.
Oh. Is that looking okay?
Yeah.
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 Okay, over to you.
So our project was around health literacy in schools. We looked at students between the ages of 16 and 18. It came about through HEE offering funding for place-based projects. We'd been having discussions about how we could support in schools anyway, and so I thought it was a perfect opportunity to get some funding and properly look at an area. So the two trusts collaborate together. We engaged with 5 out of 12 local schools. 12 were interested in participating, but due to COVID, when we started this in 2020, it stopped them participating. So we had 5 who worked with us, and then we worked with Public Health England. We worked with the school's library group for CILIP. We had a couple of conversations with the clinical commissioning group. We were looking at CILIP Thames Valley as well. So we started with 3 literature searches around how we wanted to review what students knew already about their health and where we wanted to go from there, how we wanted to look at user experience. And we did pre and post surveys with all the students. So I think we had about 80 surveys that were completed, if I remember correctly. We then did 10 user mapping sessions, both in online and in person, with the students to find out what they knew or didn't know about the health on a range of subjects, from nutrition to looking at medication to how to access healthcare. I think both myself and I think Barbara probably agree, it actually just widened our own biases. It really kind of changed our view. And then following that user mapping, we created a training session. So we had 2 training sessions, 2 different trainings, and we then delivered those training sessions both online and in person, depending on the school, to the students and their tutors. There was a lot of learning within that. I said, I think especially from that, when we were doing it online, some schools we couldn't actually see the students, others it was doing it in a group, so the activities we'd set didn't actually work as much well as we would have liked, but we did our best. So I think from it we created a website, which was the LibGuides at the Royal Berkshire. I think it's the next page. And so from this, we researched appropriate content that was out there. We, of course, delivered 2 on our training sessions, one focused on explaining health literacy and how to evaluate resources, including the CRAP test and a share checklist for evaluation. And then we created a teaching pack as well, so that the teachers could do it going forward. So it wasn't just us delivering, because again, whilst we've done it for Berkshire, you could use the content and adapt it for national. We created a set of 15 postcards, which have gone out to all of our schools, from helplines, which was a key component which we found students weren't aware of, through to alcohol awareness, women's health, men's health. And so they were distributed to the schools involved, to NHS staff, and also to our local authority contacts. And then we've created a Girl Guiding Challenge badge, which I tested on my brownies. And so now it's about trying to get that out there, because we haven't quite got there yet, have we?
No.
Someone went on maternity.
Right, I'll move forward there. Yeah, sorry.
So yes, I think those are the 3 things that we've done. And then from that, it's what we found out from our impact, which I think Barbara's going to talk about.
Yeah. Okay. So I guess also the deliverable from that, we created a sort of teaching pack that we could hand over to other people, and it's actually on the LibGuide website as well. So the 2 lessons that we created are on that LibGuide site, so other people can use it and adapt it as they want. So which was really useful. So yeah, the feedback from the sessions, I think there's some feedback there from some of the participants, some of the students. You know, there was a wide range of engagement, but some of them really found it useful, and it certainly raised questions in their minds about how they did things, where their default information, health service was that they would go to, whether they would try and phone their GP or use 111 a bit more appropriately, how to sort of prepare themselves for going to visit a health professional, more to think about what they might want to ask in advance rather than things like that. So we got some really good feedback, but we also got some really good feedback from the teachers themselves, the ones, because they all sat in on the sessions, and I think they were just quite pleased with the engagement from the students and the thought process that the students were going through, but also said, actually, I can use this back in my own family as well, which was really useful to hear. And then we also did some demonstrations to some of the school library association members, and again encouraging them to take that information away and use it if they wanted to. And several of those said they could imagine how they could incorporate it into either their own school library instruction or how it could fit into other lessons within their schools if they approached some of the other teachers. So that was really sort of good to hear. So in terms of what happened next, since then, so we put the teaching pack together, and it is available for anyone to use under Creative Commons license. And we have recently just updated that a little bit because obviously things move on. Some of the topical subjects change, so we have updated it, and that's up there. We've been quite proactive within the health literacy community of practice to share that those lessons there. And obviously we won the Lilac Award last year, and obviously we'll be handing over the mantle to somebody new at Lilac this year to get this year's award. We've also been working with the public health teams. We'd hoped to deliver the sessions to some of their Young Health Champions programs, so where the public health teams work with some particular youngsters to try and use them as champions, but hasn't quite come off. But yeah, with Alison being on maternity leave and I've had some sort of challenges in my service, we haven't taken that forward, but it's still something we would like to do. And we've also delivered presentations to the West Berkshire sort of school leads, and we're going to go back to them and do some more presentations shortly for them to see how they can use the teaching that we created. And also I think within our own trust there have been some areas of interest. I delivered to our community child and adolescent mental health services, and particularly the team called Getting Help and Mental Health Support Team in Slough that work with schools. So they actually go into the schools to support students, and so they were quite interested in the materials, and we're going to have a look at that as well. And I think Alison's team were doing something similar. And obviously the Girl Guiding badge to be launched, which I think, Alison, I don't know if you want to say anything extra about where that's got to. I know you were doing something with your own local group.
Yeah, so I've done it locally with our local brownie group. I'm now just tidying it up now that I'm back so that I can then send it more widely across Girl Guiding, so that anyone can do the challenge badge. So it will have all the resources that they need for it, and it'll be promoted through Girl Guiding.
So yes, I think that was all we really wanted to say. But if it's there if people want to, the URL is on the slides, and yeah, happy to take any questions maybe at the end now.
Yeah, that's excuse me, sorry. Yes, that's brilliant. Thank you both. And Alison's actually shared your LibGuide in the chat as well, so people can get to it from there. We'll move on to Cal so that she gets a chance to present, and then we can come back to any questions at the end. But thank you both.
Thanks, Lindsay. Can you see the slides? Is that okay? And that is it moving on? Oops. I'll just stick the next. Oh, that's better. Okay, is it moving on? Yeah, brilliant. Yeah. Okay. Hi everyone. My name is Cal Dunder. I'm head of Knowledge and Library Services. Now, my poster submission was around persona work that we carried out a couple of years ago, so it's going back 2021 actually. We got some funding from HEE at the time for some place-based funding that we received, and it was around supporting our users on our library management system. So these included our staff users and included our students as well on placement. It was part of the BASE consortium, which is now the Helm, well, part of the Helm consortium now, but it was a group of libraries in the West Midlands, Birmingham and Black Country area. And the idea was just to look at our users and what well, I'll step back a bit. So what the assumptions we do make when we look at our users and think about users is they need this, they need X, Y, and Z, but we don't actually ask our users. So we make assumptions as library managers that they might need, say, a book club or a journal club. Yes, we do surveys, but we don't get that rich data from our users. So we went into some personas being to be created, and we couldn't do this ourselves. So we actually had to hire an external company that did this for us, and they were going to create a set of personas. So looking at clinical staff, non-clinical staff, and break it down into staff groups, as well as our students as well as our non-users as well. So the idea was they would create some personas and they would do some journey mapping for us as well. So it's to basically, at the end of the day, we want to improve our user experience. We wanted to make sure we have the right services in place, things that with their little niggles that we were picking up on those within the service, for example, and I'll share some slides later on. They might want to bring a cup of tea into the library, but yet we've got notice to say no cups of tea allowed, or coffees. So things like that. It's just little things that keep our users away from us or stop them using our services. So that's the whole idea around the background to the project itself. The company that we hired used a methodology called design thinking and used center design, and the project in the completeness took 6 months to do. So it comprised of a number of things, including interviews, focus groups, follow-ups, etc. But I'll give you some more detail in that as well. When the company came about, well, when they started the project, it was the year just after the pandemic. So just bear that in mind when you're looking at these personas and the snapshot that it's taken in terms of data as well. Okay, moving on then. So those of you that obviously, well, who might not know what persona is, I've got a definition there. These are fictional representations of different types of library users. We're trying to understand their needs, motivations, and behaviours. So it's kind of that really insight of our users. So really the detail around what they do, what they like, what they don't like, their pains, their thoughts, and their needs as well. It's around those behaviours. When we came about doing the project, so we had a little focus group set up of managers within the Black Country and so the BASE consortium as well. We wanted to kind of, from the end of it, we wanted to what the results were to create a focus services to improve our user experience, which I've already mentioned. We wanted decisions to be made, not, like I said, from a librarian's point of view. We wanted to make decisions based on what our users are saying. So, purchasing relevant material, etc., marketing our services based on what our users want, and so forth and so forth. There are a number of things that we wanted at the end of this project. So the stages of the project in itself, like I said, it did take 6 months. It did take a long time. We had focus groups with library managers involved initially, just had a conversation with our vendors about our users, how big we were. We were a very large consortium. We had a number of libraries and library points involved. We were stretched through a really large geographical area as well. And the next set of the part of the project was around insights. So when I say insights, the vendors then looked at detail, they looked at metrics, they looked at, they explored the data from the LMS, for example. And can you imagine a consortium, the amount of data that you've got in that LMS? They had to break down things into active members. We looked at an atypical years, which was pre-COVID, because obviously we couldn't look at a COVID year. We looked before that as well. Looked at historical data, and our data in our LMS goes back to 2013. So they were looking at trends from 2013 around when a person joins a library, they might borrow a book and then they just go quiet and then they borrow again, and look at various trends within our data sets as well. They broke things down into students, our staff groups, and they were comparing, for example, an allied health professional to a medic, to a nursing colleague. They were looking at all that data. So the insights were gained from that data, that rich data we had in our LMS. And for all of us, we all have access to LMS, but do we really look at that data behind the scenes? It's there, it's sat dormant half the time. Yes, we run reports, but that data, they had eyes on that data, and they were actually analysing it before they actually got to the interviews and then creating the personas as well. So following that then, on unfortunately, I have to say, we only obtained, I mean, I can't remember on the top of my head how many thousands of members we've got within the consortium, but because, like I said, it was that kind of the year just after COVID, we only managed to get 60 interviews done. These were scheduled obviously around when the user could actually obviously have the interview. They were quite flexible, anytime from 8 to 8 p.m. They basically did a telephone call or an MS Teams call with them. And this is when they actually sat down and you can see there they used I can't remember that piece of software that they used, but basically, what do they think about the service when they go into the library cell? What do they feel? What do they see? What do they hear? We've got it all there as well, and the actions, etc. And all that. This is all rich data obtained from. It could have been a clinical staff member, it could have been a non-clinical, it could have been a student, and we also looked at non-users as well, which were the hardest group to actually find. So we had some insights from them as well. So they gathered all the information. They created kind of various charts like that actually from the end of it all, and then they had to analyze the data. What they created then were 8 personas. Again, sorry, apologies for the text, but I was just trying to kind of give you an overview for each one. I have got an example to show you as well. They created 8 personas. So when you look at the personas, and I'm happy to share these personas out as well, they are broken down. If you look into the detail, they're broken down into community staff, clinicians, nursing staff in that kind of sense. But what they've done, obviously, they've done a fictional representation of a particular group of staff. Now, we've got Ken there, we've got Pearl, and these, again, all made up names that the vendors actually put on there. But just take one, because I'm not going to go through each slide and each persona. But Ken, and that's the one I've got an example of, they've summarised that person as often older, feels isolated from the library and doesn't understand how to access, digitally nervous and worries about parking. These are the kind of insights they receive from that type of person, if I can put it that way. So they create a persona around so many people that gave that insight around. And say with Perla, who's a pressurised staff member, and Francis, some formal study, and they've given all this rich information. So we know where they're based, we know what they're saying, what they're seeing, and you can imagine we wanted to act on that straight away. We wanted to do something straight away to put those things right. So moving on, we've got another set. So these are the other 4 that I mentioned as well. There were 7 altogether. We've got Serena, Ruth, and Dan, and Noah, and each one is slightly different. They're defined either by their locality, what they do, their job, their background, their age as well. I mentioned age in there as well. And again, I haven't got time to go through each one, but I'm happy to share the insights that they actually created for us. But every single thing that they mentioned, we've managed now, and I will share that as well, in terms of what we're going to do, what we're going to plan, what we have done so far with these personas. So moving on, this is what they've created. So this is an example of one of the personas. So going back to Ken that I mentioned before, which is community-based staff. They've given us more say in what they're saying, their pains, their thoughts and attitudes, and their needs and opportunities. And as a group, as a consortium, each set of managers have taken these away and acted upon them. And I will share what we've done in terms of a service as well. So that was one slide set that we got for one persona, and then you also get the journey mapping as well. So that's the journey maps that they've created, and you can see where halfway down the screen where it says there's a happy face, kind of mediocre, I'm okay, and a sad face, and these are the ones that we obviously need to address straight away. These are key things that we need to do. So anything around the pain points at the bottom of the slide set, these for us, these are things we need to put right. If we could put them right, I mean, little things like around parking, paying for parking, it's not always something we can act upon, but anything that we can do, we try to obviously include that in our planning going forward as well. That's one example of a persona. So where are we now? So in terms of, I know it's going back nearly 2 years ago when the data was collected. Some of the managers in the consortium obviously acted upon the qualitative feedback that we've got. And as I've just said, they have acted and done something about it. For example, taking down the signs for don't bring your cup of tea into the library, or whatever's making the library user unhappy. They've changed that straight away if they can do. Others, so I know one of the larger trusts within the consortium is actually doing a follow-up survey, but not for everybody, just on one of the personas that they want to actually address. So for example, it could be the allied health professionals, it could be the nursing staff. They've done a follow-up survey. The consortium itself also then changed LMS supply. They become the Helm Library Consortium. We also incorporated some of those rules and changed some of those rules as well. So, for example, there's moments about we can't auto-renew, we can't have more than 8 books out, so we increased in the loan period. We've done auto-renewals as well as part of the consortium, the new consortium as well. So we've done major changes as well. In terms of my trust then, so what we did, I've had a brand new team that's come about in the last 12 months or so. So we've come together as a team, we've discussed each persona, we've created a spreadsheet of actions that we can take away and act upon straight away. We are actually, I'm in the process of creating a marketing promotional plan as well, related to those personas. And finally, so what has the impact been of doing this? What's the impact of actually getting this persona, getting an outside company to actually do this for us? I've already mentioned the marketing plan. I'm doing that as we speak. We've realised we need to promote the library. Awareness is key for us. We're not doing enough of it. And to be fair to myself and the existing team, we didn't have enough staff to do that. So we obviously expanded the team. So we've increased staffing. We've increased our library space. We refurbed our library space as well. Then another thing that came out, we're actually taking the library to the users. So a lot of the community staff are saying, we just haven't got time, we're busy, why do we have to go to the library? Why can't the library come to us? We're going to do that. That's something that we've actually, as a team, discussed and thinking about ways we can do that as well. We created a newsletter as we speak as well, again, linked to promotion and awareness, which we're doing as well. One of the team members based at Penn Library is looking at a book club, and we just talked about that yesterday on Teams, how she's going to go about kickstarting that off. We've already started the audiobooks platform, which was, again, something somebody had said. We've updated our PCs as part of the IT transformational group, because we also became a new trust as well. In the middle of all this, there's a lot of things going on. And we've also increased our health and wellbeing collection as well. There's lots more. I haven't got enough space on the board to include all the things that we are going to do on the back of these personas. So I think, yes, that brings me to the end. So that's kind of a snapshot of the persona project. And I said the funding came through the health education through the place-based funding stream as well. And we were part of the consortium. So hopefully that's me done. Sorry for the quick kind of whistle-stop tour of that. It was really, yeah, I'll stop sharing. There you go. Thank you.
Thanks so much, Cal. That was really interesting. I am looking forward to going back and looking at those personas in more detail. Thanks. So we have a little bit of time for questions. Oh, hello, Alison.
Hey, Lindsay, and apologies everybody, and particular apologies to Abby because I was a little bit late joining, but I will catch up on the recording. But really interesting. Really interesting to get underneath the detail of the posters. It's great you get an idea from a poster, don't you? But it's not until you hear someone talk about it, you think, oh, wow, that's so many things I can pull on. I'm going to be contacting Cal for those personas as well, because I've got a little project I've got ongoing, and I want to see whether you've covered one of the personas I'm interested in, so that'd be really helpful. I think there was a question in the chat, which is why I've kind of leapt in, Lindsay. So I'm just trying to, so it was from Ingrid to Hayley, actually, about time and day that you did the session. So I don't know whether Ingrid wants to ask a question in a bit more detail, or if that's enough.
Not really. I guess it's just one of these things where you always want to engage with clinical staff and there's no perfect time to try and do it. So I just wondered what worked for you, whether you had a process for it.
Oh, I think you're on mute, Hayley.
Oh,
there you are.
I'd sat on my controller. Sorry, so we started doing it on a Monday lunchtime. So we advertised it's been an hour and a half, but it usually only takes around an hour. And obviously this depends on how chatty and interactive people are feeling. But now, sort of as the process has gone on, we alternate it. So we either do Mondays or Thursdays to try and sort of create a bit of variety. And we've done a few different times between 10:30 and 11:30 around lunchtime. So we've kind of switched it up. So there isn't really a pattern or anything that we've figured works especially well or not so well. having said that, I mean, it hasn't all been plain sailing. We have had sessions before when nobody's turned up, when we've had a rescheduled session, and we've had sessions where we've had 8 people, but we average about 6, which is maybe on the smaller side, but I think the people that attend appreciate that, and they like kind of the small, homely nature of it. So I'm not sure if that's answered your question or provided you with any sort of useful information.
Yeah, I think it just confirms that like you just have to keep trying new things, and
yeah,
if 6 people come and they're really engaged, then that's really valuable, you know.
yes, and so just to add, one of the benefits has been that if we've had people come, we have really engaged allied health professional teams and nursing teams at KMPT. So we've often had people come who are supervising students and who have then invited their students along. So a lot of it is just spread by word of mouth, and sort of those sort of close networks. But yeah, I don't think there's any sort of hard and fast rule, or so yeah.
Brilliant, thank you, Hayley. Again, I'm really impressed at the level people seem to be engaging with it. Does anyone else have any questions for any of our speakers?
Not a question, but again in the chat, just from Derek, just sharing a sort of slightly different approach, I suppose, to that persona piece. Derek, did you want to just come on mic and just say any more in relation to your...
Hi everyone. Yeah, I just thought it kind of tied in with the last presentation about user experience and something that that was recommended through our network. And I think a colleague had tried previously, this idea of a love letter breakup text. It's, I suppose, a fun way of just getting user feedback, a bit more engaging. So obviously love letter is, you know, what you like, and I guess the breakup bit is what can we improve. So, you know, it's just another kind of quick way to gather a bit of user feedback, and we did it in February during, you know, to tie in with Valentine's, I guess. So things like that are maybe useful to capture some quick feedback, and hopefully it's a bit of fun and engagement.
That's super, Derek. Thank you. I love that idea. I've heard of it before, but it's great to see it's actually worked as well. And you've got I think, like you say, injecting a bit of fun into it is always a good thing, isn't it? If you can.
Yep.
So, yeah, brilliant.
Thank you.
And you've got a heart as well, which is very appropriate. Thank you, Helen.
Yes.
I have to say, I could have extended all of those lightning talks today and heard more. Have been so useful and really interesting. I've got a pile of stuff that I'm going to go back and read and link back to. So thank you to everyone. We do have time for a couple more questions if anybody has one. While I think of it, I'm just going to share in the chat again the link back to the other posters. So if this has inspired you to go back and look at anybody that's presented today's posters are still there, but all the other attendees are there as well. You can find them on the HLG 75. Oh, that's horrible. My picture comes up. It's really big. Don't let that put you off, but
just lots of thanks, I think, coming in. Yeah.
Well, as we said at the start, we will send round the slides, and the recording will be made available on that HLG 75 page as well. So if anybody's got any questions, you can get in touch with us and we can pass it on as well. So thank you to everybody for coming, and can we have another virtual round of applause for our 4 speakers today? Thanks, everyone. And thank you, Alison, sorry, for helping to facilitate this session.
A bit poorly coming in late, but yeah. No, thank you, Lindsay. Thanks, everybody.